In this video, I'm going to help you understand how pain medications work. But first, I'd like to explain to you that pain signals allows our bodies to protect from further injury. Let me give you an example. When one places a hand on a burning pan, pain allows us to remove our hand as quickly as possible in order to avoid further damage. These signals from the hand to your brain and spinal cord is being transmitted through specialized nerves, and is being transmitted through electrical stimulation that's being communicated from nerve to nerve with chemicals that we call neurotransmitters. Now, understand that pain medications of all, whether they're plant-based or they're synthetically based, what they do is they manipulate and modulate these neurotransmitters in order to either obstruct the pain signal, or sometimes it could amplify the signal. So understanding how these neurotransmitters work is very important when we're choosing a type of medication. Now, I want to discuss about we like to categorize medications in different categories. One is opioids, another one is anticonvulsants, another category is antidepressants, another category is muscle relaxants, and finally local anesthetics to numb the nerves are different types of pain medications. I'm going to discuss first about opioids. Opioids are derived from a plant-based, most of you familiar, is called Seminiferum papaverum is the name of the plant. Others know it as opium, and from this plant we basically are able to extract opioids, which is mostly morphine and codeine, and then there's other chemicals in the plant. We have been able to synthesize these chemicals on a mass production basis and other similar compounds to utilize in pain practice. How these chemicals work is by modulating pain transmission by specifically binding to some receptors in our brain and our spinal cord that we call opioid receptors. So opioids work by stimulating opioid receptors, which again block pain impulses. I want you to understand that opioids, even though they have many risks, they have significant amount of benefits. In my opinion, opioids revolutionized the practice of anesthesiology. Back 50 years ago, we couldn't provide safe anesthesia for people who were undergoing brain surgery or heart surgery. Opioids revolutionized to the point that we were able to provide anesthetics in these conditions in a safe manner. Now, we are able to use these medicines also on an outpatient basis, but again, they have their risks. Some of these risks, most of you are familiar with, can cause physical addiction, psychological addiction. There could be endocrine problems, respiratory depression, nausea, vomiting, constipation, are some of the side effects that are quite common in utilizing opioids. And also there's other side effects such as decreased libido and itching. Again, we have to be very cautious when we use these medications, and we just try to use them only if they're extremely necessary. Again, the benefit has to outweigh the risks. Other synthetic opioids that are not morphine, it's medications such as tramadol and buprenorphine. These have a lower incidence of addiction, respiratory depression, along with other side effects that I mentioned. The other class of medications, anti-inflammatories, you're familiar with because they're very commonly used. You could get them in the pharmacy, such as ibuprofen, naproxen, and then there's many other prescription anti-inflammatories that we utilize in order to decrease inflammation. I must make a note that inflammation is good because the body is constantly in an inflammatory stage because our bodies are constantly healing themselves. And so inflammation is a normal process that's happening in our bodies, but sometimes they create pain when there's an injury, and that's why we use anti-inflammatories in order to decrease these chemicals that are stimulating the pain signals up to your brain. So again, by using anti-inflammatories, you're providing analgesia, but through their anti-inflammatory effects. The other class of medications are anticonvulsants. Now, you would think, well, we don't have seizures. Well, pain is a seizure. It's a micro seizure because if you recall, I explained that pain signals are electrical signals that are modulated by chemicals. So by using anticonvulsants, basically we're able to decrease the nerve activity. Some of the commonly used anticonvulsants in our practice are medications such as gabapentin, lamictal, and others. But gabapentin is the most common anticonvulsant we use in our practice. Now, the other class of medications, such as antidepressants, is again a big topic, but suffice it to say that antidepressants also modulate these chemicals, such as serotonin and norepinephrine. Not to confuse you, but basically these chemicals are involved in modulating pain at the spinal cord and the brain. So again, by using some antidepressants, you're able to provide analgesia in some of these pain conditions. And furthermore, patients who do have chronic pain, guess what? They usually have mood disturbances, right? They have depression. And so you could kill two birds with one stone, as we say. You treat the depression, but you're also treating the pain. Then the other class of medications are muscle relaxants. Again, these are medications that are directly or indirectly are relaxing muscle for spasm when people have spasms from their chronic pain condition. And again, I won't go too much detail into these because there's a wide array of muscle relaxants. And last but not least is local anesthetics. We use this in anesthesia a lot. Injectable to numb the area, or we use patches now, patches that have lidocaine or tetracaine or novocaine to basically numb the area if you have localized pain. And last but not least, there's other novel medications such as Botox injections, which relax muscle, so they could be used for muscle relaxation, but also used for pain relief.